So, what do you think a psychologist's job is about? I would tell the most important thing. The most important thing what a psychologist does is using a dialogue, contemplating, studying, and tries to find and diagnose errors, defects in the thinking processes and mental processes of a patient and picks the right ways, techniques, and methods to remedy those defects, those errors, helping the client to do so, and helping him to make it his habit, his skill. Some psychologists write articles, some make videos, and there are movies where we see a patient lying on a couch during a therapy session. And there are other movies, among Russian movies, among those, and they show how dangerous sometimes this job can be. So, do they show psychologists work properly, or it's just a tip of the iceberg? Well, basically, that's a medical approach. There are more advanced approaches, the way we do things, at least I do. These can be done in motion. So there is such an approach, a Socrates dialogue, when an individual is static, is not moving, he is stiff, and yes, he can be relaxed, by creating some kind of an environment around him, using aromatic oils. These things work, but an individual is more under the influence, in the territory of a psychologist, in a way. And when you are in the nature, blending in, two people are equal, they are on par, right? And when you are in the territory of a psychologist, the individual would always feel a bit uncomfortable, and there may be other people around. Yes, one can get accustomed to it, but so if you're speaking about ways of interacting with psychologists, there's a lot more of them than it's usually shown. So I guess the key thing is when a patient comes to a psychologist, shares with his problem, and a psychologist helps him find a way to tackle it, right? This is what his job is about. So basically, the thinking process, when the thought is originated, it flows, and when it stumbles or upon, it's not developing, it's going in loops. So without knowledge and skills, an individual comes to someone who could help him find these defects, these errors, remedy those. And right now there is a trend when a psychologist teaches a patient how to do so independently, right? So like a teacher psychologist. So they could learn to think properly. And as you have said, we're highlighting the moment that the problem is that thinking is based on concepts, right? And the psychologist clarifies some things to understand what the problem is about, whether that's a definition or a meaning, or there is an connotational association. And so that the word would fit the images that stand behind them, right? Like the phrases would align with what the client, that he uses proper words to describe what his problem. And this is basically getting or acquiring a knowledge. And at some point of his life, when a patient stumbles upon an issue, he starts to tackle it. And what starts then? The cognitive process starts, studying, researching, acquiring knowledge, and an individual stucks. So he goes to a psychologist, and it's not every time a psychologist can provide the necessary knowledge and skills. Well, I'm judging from my experience. So you can share your knowledge, and teach the patient. And a psychologist assists a patient in setting his thinking processes, his mental processes properly, so it would work to help an individual acquiring knowledge, which then becomes a part of his inner world, of his mentality, and it becomes a habit, a skill of a sort. Should a psychologist be skilled in, be a master of logics, and what other sciences apart from logic a psychologist should master to assist a client? If we pick, well, a psychologist, basically, first of all, he should be a master of dialectics, one thing. Secondly, he should understand the fundamentals of thinking and be capable of contemplating. So dialectics is basically the art of contemplating, and that is to ask proper questions, which is the easiest part. And so basically the skill of formulating questions, of different kinds of questions. So basically, and that's not the most important at this point. And the key is that the psychologist should understand what logics is about. It can help in some particular situation with some particular problems, but not so much, to be honest.